Hi there, I'm Karen Holloway, occupational therapist working for Hywel Health Board as part of the Community and Primary Care Services in beautiful Pembrokeshire. I'm going to be providing you a synopsis of the Health and Work Champions project, provide an overview of the work as a health outcome training being rolled out nationwide, and tell you how we adapted from planned face-to-face group training sessions to virtual training sessions. The Work as a Health Outcome training session is part of a national project to get staff thinking more about health and work. It is an innovative project that aims to create culture change in health and social care, so it is routine practice for all staff to be able to talk about employment with the people they work with. Training sessions are delivered by Health and Work champions to encourage colleagues to routinely ask and support people with their employment aspirations. The NHS alone, for example, has 1 million contacts with people every 36 hours, and many of those are lost opportunities to talk about the health benefits of good work. The Royal College of Occupational Therapists have trained over 100 health and work champions across the UK in multiple settings, including acute and community settings for people with mental health, physical health and learning disabilities. Leanne Owen, who works in Carmarthenshire, and Susan Crompton, who works in Ceredigion, and myself carried out this training and were due to roll this out within our service for the Health Board. We had scheduled dates in the diary and venues were booked. Then we were in a position of having to enact our OT service escalation plan in response to the COVID pandemic. Therefore, all non-essential activity was halted. The Work as a Health Outcome training explores the important link between work and health and the importance of asking about work or other meaningful occupation. During the course, participants get to learn what the best predictor of a person's health, quality of life and life expectancy are, and explore models and evidence surrounding the social determinants of health, such as the socio-economic factors including education, employment, income, housing and social support. Identifying that employment is one of the most important determinants of physical and mental health, recognising that the long-term unemployed have a lower life expectancy and worse health than those who work. It is associated with an increased risk of mortality and morbidity, including life-limiting illnesses, cardiovascular disease, poor mental health, suicide and health-damaging behaviours, and has a wider impact. For example, children growing up in workless homes are almost twice as likely to fail at all stages of education compared with children growing up in working families. Participants are asked to reflect on how they benefit from their working role and provided the statistics associated with those that manage their health conditions while in employment. Exploring that the ability to work does not require the person to be 100% healthy, and recognising that not all work is good for health. Unsafe, badly managed and unsupported workplaces still cause a significant burden of ill health and injury in the UK. The factors that are significant for good work, that is good for your health, are explained. The 5 R's are explained and explored, which are about raising the work issues early, recognising risk factors of being out of work, respond to straightforward work problems, referring people on who need more help, and revisiting work issues at regular intervals. The course then provides useful questions to consider and what professionals need to think about in different scenarios and situations. An overview of benefits to be aware of and a breakdown of national and local services of where service users can be signposted for support is provided, finishing off with reflections on how participants are going to do things differently in the future. So being aware of the benefits of good work on good health and the importance of all health care professionals addressing this topic, we didn't want the opportunity to spread this training missed. We got permission from our head of OT service to add health and work training onto the OT training plan at the end of May, as well as from the Royal College of OT to virtually roll out the training and agreed to trial delivering sessions via Teams. Initially, we were going to have the 3 facilitators in the same room. However, booking of rooms and accommodation on health board sites became very difficult. So we agreed for facilitators to all also be remote, each of us presenting from a different county in the health board, doing one presentation. In preparation, and not being very IT savvy at the start of all this, we asked for support from our administration staff who set up the session on Teams, providing clear instructions for accessing the platform to participants. With 3 facilitators, we coordinated who was doing what parts of the PowerPoint presentation, being aware that the person who shares the screen wasn't then able to see participants or the conversation bar. We were aware to prepare the room, ensuring appropriate professional background, i.e. no knickers on your radiators. Bringing the laptop to eye level, ensuring it's plugged in, attempting to accommodate correct lighting, for example, a solid light background sat facing the window or facing the strongest light source in the room. I have difficulties with my Wi-Fi at home, so have to source a room that will accommodate me in the trust, and we ensured we have access to refreshments. When presenting, we established clear ground rules, starting off with the following script. Please follow the housekeeping in your place for your venue, such as fire alarms, and responding to any other alarm systems that are relevant to where you are. Before introductions, can I have a show of hands that you can all hear me? If your connection is poor, turn off your video and backdrop if you're using one. This will improve your audio. Place your mic on mute if you're not speaking. There will be time for questions at the end. Please use the conversation bar to type questions as we go along, if that will assist you in remembering them. All slides are numbered, so please put slide number with question for ease of reference in the question session at the end. There are 3 of us facilitating remotely today. We may have our cameras off whilst we're presenting to allow ourselves opportunity to coordinate presenting screens, moving PowerPoint on and speaking. You'll be able to hear our audio clearly. When presenting, we say, next slide please, when ready, so the facilitator controlling the PowerPoint screen knows when you're ready. We found that having our cameras off when you're presenting helps with nerves, helps you being able to read out any pieces of information you may have written down in addition to what is on the slide, and ensures your audio is clear with no interference, especially if you have poor connection. Some of the challenges we experienced were the connection, as previously mentioned. The group discussions felt stilted and challenging to facilitate. 2 options we considered were using microphones and allowing people to raise their hand to comment, or open mic, but we thought this would be a lot of talking over each other. We used the conversation bar to facilitate the group discussions, responses from audio to questions. The facilitator's screen sharing can't see the conversation bar, therefore co-facilitators led the discussion on the conversation bar, reading out what the audience had written. On our initial session, those who joined via social services computers were unable to view the screen share PowerPoint. This has now been resolved. However, be mindful, if not everyone can see what you're sharing, you will need to email them a copy of the PowerPoint to follow along, if that's possible. We added 2 employees' personal journeys to the presentation, but the audio volume was quiet. You have to be mindful of this when adding videos. Other problems could be hardware malfunction, a power cut, unforeseen background distractions, other people's connections, background noise and feedback, and accessibility on phones or tablets. Some top tips to consider. If you're speaking, be mindful of any noise you might be making when moving paper. Page turning, background noise from other people in the house, as it all amplifies on your microphone and may interrupt what people hear when you're speaking to a slide. When co-presenting, ensure all additional pieces of information you have written down that is not on the slide is written in the notes section on the PowerPoint presentation. This enables co-presenters to pick up where you left off if you have IT issues and lose connection. It also allows co-presenters to pick up and roll with your part of the session if you're unable to attend or if you're off sick. You can't fix everyone's IT problems. Advise participants to contact the IT service for support. They can always rejoin a future session instead. Ensure your session starts and finishes on time and engage with people straight away, or you'll lose their concentration and interest. Thank you for your time. I hope you found this interesting and beneficial. If you have any questions, please do get in contact via email with myself regarding anything I've presented today, or to my regarding Health and Work Champions project. Thank you.